Okay, so as I said, the body scan is what we'll do now. And so why don't we take a minute, if you like to do this lying down, so we have a spot that you can do that. If you'd like to do it sitting in a chair, I'd like to invite us all to kind of lean back a little bit. Oh, you can't really see. As you'll see, this is a contrast to other mindfulness exercises where I'm going to encourage everybody to sit up. For this one, though, we could really lean into whatever supports you've got, and probably most useful to have your feet flat on the ground. Oh, and I forgot another thing that's different, of course, doing this in person and as opposed to on Zoom. So when we do it in person in the VA, we'd have clean floors. We'd also invite everybody to take their shoes off. So if you like, of course, you're welcome to keep your shoes off or leave them on if you like. But I think for many of the exercises, it's actually very helpful to have shoes off, either barefoot or with socks, to help to be able to bring awareness to all parts of your body. Speaking of which, we'll take the jacket off. So we take a moment to get comfortable and to sit in a way that we can kind of be comfortable for 20-30 minutes. And of course, if at any time you're uncomfortable or you'd like to stand up or adjust your posture, please feel free. So there's nothing here says we have to sort of maintain a particular posture. This is a yoga class. But so to begin, maybe entering into or finding, I should say, a position in your chair that feels comfortable. Your weight is nicely supported, and your legs and arms are comfortable resting, feet flat on the ground. Sort of your hips and shoulders and back are supported by your chair. And closing your eyes, if you like to. You can also keep your eyes open if closing the eyes doesn't feel comfortable. But closing the eyes really helps to bring awareness inward. And we're going to focus a lot in this exercise and other exercises we do on we call our internal experience. So what's happening, under the skin, what's happening inside our bodies and inside our feelings and our minds. So taking this opportunity to close your eyes if you like, and to just let your awareness come to whatever is present. Maybe noticing that thoughts are present, noticing that you may be able to feel different parts of your body, feeling where your body's making contact with the room, maybe feeling where your feet are touching the floor, or your arms and back and shoulders are touching the chair. Just letting your awareness go to whatever sensation calls out to it. And you may notice that your attention, your awareness goes in different places. And also noticing sometimes your awareness goes towards sensations, sometimes to thoughts, sometimes to sounds, sometimes to feelings or emotional feelings or sensations in the body. So all of these are what we call sometimes mental events. And the practice of mindfulness pays a lot of attention to mental events. Pays a lot of attention to noticing when we're experiencing one thing and then we move to another thing, for example, noticing thoughts. So throughout this exercise, I'm going to invite all of us to really bring our awareness to particular parts of the body. And we're going to basically visit every part of the body, sort of like, but of course, when we do this, you might notice that your mind goes someplace else. It maybe goes into the future and time travels into maybe what's for dinner, or what about the deadline, or do I have to take my dog out, or all these things. Or you may go back to the past and think about what happened yesterday or third grade, or you may find a commentary. So all of these things are completely natural, normal. Don't be surprised. And it doesn't mean you're doing the exercise wrong. It means that you're a human with a brain. So, but the invitation throughout this exercise is, if you find your mind going someplace else, I'd like to invite you to very gently invite it to come back. Okay? So, as you bring awareness to the body, noticing points of contact, noticing internal experience, you'll probably become aware of the fact that there is a rhythmic process going on continuously. Every couple of seconds, air is coming in through your nostrils. And when it does so, it goes down your windpipe and fills the lungs. And each time your lungs fill with air, there's a gentle expansion and stretching of the chest and abdomen. And every time that happens, just maybe, a moment later, sometimes less than a second, then the air comes back out. So, and then the process repeats. So I'd like to invite us all to pay some attention to this process of the breath, noticing air coming in, air coming out. And the rising and falling of the breath, particularly if you're lying down on a mat, can sometimes feel almost like, if you like metaphors, almost like the rising and falling of a gentle ocean, the waves. So riding the waves of our breath, gently, the top of our breath, and then exhaling to the bottom of the breath. Just noticing this process and letting the breath be normal, sort of letting it sort of breathe itself while we notice sort of what happens without trying to force, just letting the breath breathe. And letting your awareness as well sort of move out to every part of your body. Again, noticing your toes and your fingertips, your ears, sort of all the torso and trunk and legs, head. In a sense, noticing the spaciousness of your internal experience. And perhaps feeling some stillness, although it's also not uncommon to, if you feel some agitation, sort of noticing that as well. And I'd like to invite you to move your awareness sort of as if you're shining a flashlight. So move your awareness to the left side of the body and then move down. So down sort of past your hip into your leg, past your knee and past your ankle, and bring your awareness to the big toe of your left foot. And see what it's like. What do you notice as you bring awareness to the big toe of the left foot? Can you feel anything? Can you feel perhaps your toe touching the floor or touching your sock? Or can you feel your big toe touching the toe next to it? Or perhaps you bring your awareness to the toe and you don't feel anything. In that case, that's what your experience is. You might notice that when you think of the big toe, you automatically get a mental image of a toe, and that's also very common, very normal. But I'd like to invite you, in addition to that image, to also bring awareness to the sensory component, the tactile sensations of the toe. An area, we don't normally pay attention to our toe unless we bang it into a wall. But noticing your toe right now, this particular instant. And noticing that as we bring awareness to the toe, that we're continuing to breathe as we've been breathing all day. And if you like metaphors, you can imagine that it's almost like you're breathing all the way down to your toe and breathing out. Sort of letting the awareness of the breath also help strengthen the awareness of the tactile sensations in your toe. And holding your toe in mind and your attention, gently expand your attention to include both the big toe and also the toe next to it, the second toe. Can you feel it as well? Can you feel it touching your big toe? Or maybe touching the toe next to it? Or maybe the feeling of air or your sock? What do you feel? What do you notice? And then expanding your awareness again now to the third toe. Can you feel it? What does it feel like? What do you notice? And then coming to the fourth toe. And the fifth toe, the pinky toe. Now take a few breaths, noticing all the sensations in your 5 toes. Or you might notice that you can make out 1 or 2 toes, but not all the toes, or there might be sort of a general toe area. You might notice as you bring awareness to one toe, you lose awareness of the other toe, and vice versa. Or you might not. Maybe you can feel all of your toes individually. So whatever it is, you're doing it right. The purpose and the object of a mindfulness exercise is to come into contact with what your sensory experience is right now. So continue breathing and continue noticing the sensations, the tactile sensations of the toes. And then we're going to start moving or scanning up the body. So from the toes, expand your attention to include the ball of the foot, the sort of area, a slightly tougher area, right below the toes, carries weight. It's called the ball, or noticing it. It's next to the toes, but may feel different than the toes. It may be touching the floor. What do you notice? And then expanding further from the strong area of the ball of the foot into the arch of the foot, right behind it. Maybe a little more sensitive. Not as strong, but, what does it feel like? It may not be touching the floor. There's a little bit of a curvature of the foot. And then into the heel. And noticing it. And then continuing to breathe. And again, if you like visual metaphors, sort of breathing all the way down into your foot. Take a couple of breaths to notice all of the sensations in your left foot, from the heel to the toes and everything in between. Noticing the lower part of the foot, the upper part of the foot, the back and the front and the toes. If you're not wearing socks, you may feel sort of a coolness of the air, or you may notice where you're touching the ground. And continuing to breathe, start to move the awareness from the foot into the left ankle. Of course, it's very near the toe, but it may feel very different. It's a different part of the body. Noticing the muscles and the ligaments and bones, the skin. Moving up the left leg, noticing the large muscle of the calf and the shin and the bones. Moving up to the knee, noticing the knee and the area behind the knee. And continuing to breathe, start to scan up your left thigh, sort of the large muscles and the large bone of the femur, so all the way up to where your thigh bone sort of connects with your hip. And taking a few breaths, again, expanding awareness into your entire left leg. So noticing the thigh and the knee and the ankle and the toes. Noticing the many parts and many different simultaneous sensations as you bring awareness into the left leg and foot. Taking a couple breaths, noticing the left leg. And then again, as if shining a spotlight or a flashlight, move awareness to the right side of the body. Move down the right leg, past the knee, past the ankle, into the big toe of your right foot. Similar, but different. What is your experience right now as you bring awareness to the big toe of the right foot? Can you feel it? Can you feel it touching the ground, or touching the toe next to it, or touching your sock? Continuing to breathe, and if the metaphor makes sense to you and you like to, sort of breathing into your toe. And we'll again expand the awareness from the big toe into the second toe, the second toe into the third toe, third toe into the fourth toe, and into the pinky toe. Breathing into the toes, sort of noticing all the toes together We're seeing which toe sensation becomes dominant. One toe sense may take over the other toes, or maybe not. Maybe it shifts between them. Noticing your toes. And then let's start to move the awareness from the toes into the ball of the foot, from the ball of the foot into the arch, and the arch into the heel. Breathing down into your right foot, noticing all the sensations of the right foot. We'll start to scan up the right leg from the heel into the ankle, from the ankle moving into the calf, moving around to the shin, coming to the knee and the area behind the knee, moving up the right leg into the thigh, the large muscles, the large bone, all the way up to your hip. And again, taking a few breaths to notice now all of the sensations in the right leg, from your hip down to your toes. Noticing that there are a lot of different parts of your right leg, a lot of different sensory experiences that we can do sequentially, perhaps, or you can try what it's like to sense it all at once, if possible. Continuing to breathe into the right leg, noticing all the parts of the right leg and sensations of the right leg. And then expanding your awareness into both legs. Just letting them be while noticing. And noticing the information that's flowing from your toes and your heels and your thighs and knees. There's this amazing amount of sensory data that's coming into your brain and your mind, into your awareness. So both legs. And continuing to breathe. And bringing your awareness, we're going to scan up the body. So from the legs, moving into the pelvis. Maybe noticing first center of the pelvis, the pelvic floor. And moving toward the back of the pelvis. And what's called the sacrum, the area where your spine kind of merges or fuses into your hip. So noticing the tailbone is there, and some other bony structures of the hip and the sacrum. We're going to start to move up the backbone. So noticing first the center of the pelvis, and then moving into the lower back. It's called the lumbar region. There are several vertebrae there. This is an area that's a bit curved. It's right above your sacrum. So noticing this area, noticing the spine itself, the vertebrae, if you can. You may be able to make out individual or sensations within individual vertebrae, or you may not. I'm not so good at that myself. But I can feel sort of that area and noticing the muscles around your spine and noticing the tissue around the muscles and the skin on top of the tissue. Moving to the front of the body, so the lower belly and everything between. So noticing the lower gut. What does it feel like? And again, you may, if you're anatomically trained, you may get images of intestines or stuff. But what does it feel like? Can you make out any internal sensations? And as you breathe in and breathe out, does that change these sensations at all? Moving back to the spine, the lumbar spine, let's slowly start to move up the backbone. There's 4 or 5 vertebrae in the lower back, then moving into the next segment of 4 or 5 vertebrae, the thoracic area, sort of below the rib cage, but above the belly. So first noticing sensations in the spine or the backbone. What is there? Noticing the muscles around the spine. We'll start to move out into the front of the body and the sides of the body. Noticing the tissue and skin, all the sensations. Again, there's a symphony of tactile information moving up into our brains and our minds. And seeing if you can move your awareness into the center of the gut or the upper thorax. And again, if you know anatomy, you might see images of a liver and pancreas and duodenum and intestines, which is fine. You can try to feel your liver or your pancreas. I certainly can't do that, but maybe you can. But maybe just noticing the internal sensation, sort of below the diaphragm, below your rib cage. What do you feel? And all the tissue and muscle surrounding this area, what does it feel? What do you notice? As you breathe in and breathe out, do these sensations change? And as we do this, if you notice sounds sort of pulling you away, there was a police car going by, sort of noticing that, noticing how your attention can kind of move around, and then bringing it back to your thoracic area of the spine. And let's start to move up the spine, moving more into the area of the lower rib cage, noticing the spine here, the muscles around the spine, and the tissue and the skin. Noticing your rib cage, seeing if you can, what can you feel? What do you notice? Can you feel your lungs filling with air as you breathe in? And can you notice the sensations as you breathe out in the lungs and the area around the lungs? You might notice the feelings are sort of stretched into different parts. Within the rib cage, below the rib cage, what do you notice? And I invite you to sort of continue moving awareness now into the upper chest, starting with vertebrae, the spine, the muscles around the spine, sort of moving around to the front of your chest. Then moving into the center of your chest, sort of where your heart is, and being curious. What are you able to feel? What do you notice? Some people are able to actually feel the beating of their heart. You might feel the beating of the heart, or you might not. But be curious about what you do feel. And continuing to breathe. And we'll slowly continue moving up the back, the spine, also noticing the shoulder blades and the shoulder. Maybe moving up to where your spine meets your shoulders, the muscles and bones there. Taking a couple breaths, sort of noticing the muscles and the sinews and the ligaments. And I invite you again to move your awareness like a flashlight now into the left arm, sort of moving past the shoulder and the muscles of the left arm, down the arm, past the elbow, past the wrist, and coming to rest on the tip of the index finger of your left hand. Just noticing, maybe if your palms are facing up, if that's comfortable, this sort of helps to bring awareness into the finger. And notice what happens when you bring your awareness specifically to the index finger. What do you notice? Some people report feeling a little heaviness or warmth. Perhaps you can feel the pulsing of the pressure pulse of your heart. Just bringing awareness to whatever is there. And then we'll expand. We'll start with the index finger and then expanding into the middle finger, noticing it. Expanding into the ring finger and the pinky finger. Taking a couple breaths, noticing all the sensations in your 4 fingers. Again, can you feel them all at once? Or does one finger dominate, or they go back and forth? What is your experience? And then moving awareness from the fingers, moving down into the hand and the palm of the hand, and the large muscles of the thumb, and the joints of the thumb, and the pad of the thumb, the thumbnail, and letting your awareness encompass, sort of expand into your entire left hand and fingers, all the parts. The hand is sort of exquisitely innervated, has so many sense receptors. Sort of opening up to this experience, opening up to being aware of the different simultaneous sensations of the fingers and the hand, the thumb, palm. If you like the visual metaphor of breathing into the hand, and you can do that. And we'll start to move, expand from the hand up the left arm, from the hand into the wrist, maybe investigating, moving into sort of all the complicated bones and cartilage and of a functioning wrist, moving from the wrist into the lower arm, moving up to the elbow, and the elbow moving into the upper arm, and noticing the large muscles, the biceps and triceps and quadriceps, and these muscles, and taking a couple breaths to notice all the sensations in the left arm. from the shoulders to the fingertips and everything in between. And then again, shining the flashlight of your attention now to the right hand, moving down the right shoulder, past the elbow, past the wrist, coming to a rest in the tip of the index finger of the right hand now. Continuing to breathe, moving from the index finger to the middle finger, from the middle finger to the ring finger to the pinky, moving awareness from the fingers into the palm of the hand, into the large muscle of the thumb, and the thumb itself. Taking a couple breaths, noticing sensations in your entire right hand. And moving up the right arm from the hand to the wrist, from the wrist to the lower arm to the shoulder. Taking a few breaths, noticing again, the sensations in your right arm. Many different parts, many sensory fields. Allowing the breath to strengthen the awareness of the right arm and expanding into the left arm as well. Again, the sort of exquisite spaciousness of how much is there, fingers alone, and all of the left and right arms and hands. And again, moving awareness now back into the shoulders, back into the neck. And we'll move up the neck a little slowly, sort of noticing again the vertebrae of the spine, the cartilage, the windpipe and the esophagus and the muscles and the tissue and the skin. We breathe in and breathe out, and coming up to the back of the base of the skull, where our spine meets our skull. And let's move around on both sides from the skull, the base of the skull, into the jaw, or the area right that ties our jaw together to our skull, so the temporomandibular joint. Fancy term, but noticing, sometimes painful area. Noticing the muscles of the jaw, the bones of the jaw. Moving down the jaw into the front of the head and the chin. And from your chin, sort of noticing the tissue and bones and skin of the chin. Moving back into our lips again, like we did with the raisin exercise, noticing the lips and the teeth and the gums, the inside, the interior of our mouth. Maybe noticing our tongue, maybe staying still, maybe moving around a bit, maybe on the roof of our mouth. I'm very curious about sort of the sensations of the mouth and the teeth and the gums. And moving into the upper lip, right below our nostrils. You may notice that you're able to make out the real subtle sensation of the movement of air from your nostrils over your upper lip. This is a very famous Asian and Indian focus of attention in different meditation and martial arts traditions. So noticing this subtle movement of the air, moving into the jaw, the cheek, And moving around, noticing that you have ears, they have sensations. And the cheekbones, the area below your eye sockets, the eyeballs themselves and your eyelids have certain sensations, the muscles around your eye, the bottom of the eye, the top of the eye socket, the eyeballs themselves, your eyebrows, forehead, many sensations coming all the way up to the tip of the crown. Noticing that. And then letting your awareness expand throughout your entire body, moving from your head down into your arms to the tips of your fingers, moving through your torso, and chest and torso and pelvis and thighs, all the way down to the toes. And let's take several breaths. Just noticing. Perhaps you notice a sense of stillness and awareness. Noticing again the spaciousness or the sort of how much sensation, how much is there. Noticing that the breathing has continued, continuing to breathe. And then notice what happens with the knowledge that we're about to conclude this exercise. We haven't done so yet. We're still in it. Maybe notice if there's any subtle preparation to move or any shift in anything when we come into contact with the knowledge that we're about to end this and move on to something else. Again, noticing the breathing and whatever else is there, any thoughts, any feelings. And to conclude this exercise, since we've been in stillness for some time, maybe gently moving the body back into motion by maybe flexing the fingers or the toes, moving your shoulders a bit. And if you're lying down, maybe bringing yourself, carefully and thoughtfully into a seated position. And if you're sitting down and you've been sort of moving back into the chair, maybe having a bit more of an upright. And bringing our awareness. So we spent a good 35 minutes internally, really noticing and sort of a personal internal space. And now I'd like to invite us to move into more of a social dimension, sort of coming back to looking at the glowing rectangles in the device in front of us, and